pseudo-menopausal state, hot flashes and all. Please excuse the rooster that is going to appear throughout this video. I tried to film this video 20,000 times and there's always a freaking rooster in the background. Who's gonna take me seriously like this? Who?
Hello Internet, welcome to my channel. My name is Stephanie and today we are going to be talking about women's health. Today's particular topic of conversation is going to be endometriosis and adenomyosis. Both of these conditions have the potential to cause infertility. Both of these conditions are chronic, there is no cure, and both of these conditions have the potential to be very crippling both physically and emotionally.
There is the rooster.
According to information found on a website called endometriosis.org, which I will link down below, 1 in 10 women suffer from endometriosis during their reproductive years. That is a whopping 176 million women worldwide struggling with this condition. And yet, it is not talked about as much. So the purpose of today's video is to change that, is to spark conversation about this topic and bring awareness to this condition that affects so many of us. Another reason why I was inspired to make this video is because I myself struggle with both endometriosis and adenomyosis. In my particular case, it looked a little bit different than usual, meaning that the symptoms that I experienced were not the typical cookie cutter symptoms. So for you weirdos out there that might be having symptoms that are completely different from the norm and you are struggling and you don't know what's going on and you feel isolated and you feel crazy, this one's for you. This video is going to be divided into 4 sections. Timestamps will be provided down below just in case you want to skip over a section or you're just interested in one particular type of information. First, we're going to be discussing what endometriosis and adenomyosis actually are. Then we are going to be talking about the most common symptoms and how it looks like typically for most people. Then we're going to be discussing how these conditions are diagnosed and what the treatments are. And finally, I want to wrap up the video by sharing my own personal experience and struggle with endometriosis and adenomyosis. Before I explain what these conditions are, let's talk a little bit about anatomy. Our uterus is composed of 3 layers. From the innermost layer to the outermost layer, we have the endometrium, which is the layer of the uterus that proliferates, sheds, and bleeds every single month in response to hormones such as estrogen. Then we have the myometrium, which is the muscular layer of the uterus. And finally, the outermost layer is called the perimetrium. Keeping that in mind, let's talk about what endometriosis is. Endometriosis occurs when the cells that compose the endometrium, which is the innermost layer of the uterus, start popping up in places where it shouldn't be. These cells start colonizing places where they don't belong, such as your ovaries, fallopian tubes, sometimes even your bladder or rectum. The problem with this is that they're not only popping up in places where they shouldn't be, they're retaining their function. So what is their function? Every month, in response to hormones such as estrogen, they proliferate, shed, and bleed. But when that happens in the endometrium, inside of our uterus, that shedding, that blood has a place to go. It travels through our vaginal canal, down our vagina it goes, and we have our monthly period, which we love to hate. When this happens in other places, however, such as our ovaries or our fallopian tubes, that blood has nowhere to go, so it accumulates. And that causes inflammation in that region, which leads to a lot of the symptoms experienced, such as very, very painful periods. All that inflammation can end up causing scar tissue, which can translate into fertility issues later on. Endometriosis, on the other hand, is pretty much the same thing. It's the same concept. Endometrial cells where they shouldn't be. But the term adenomyosis is more specific for when these cells, these endometrial cells, penetrate the muscular layer of the uterus. And again, it's the same problem. Every single month, in response to hormones such as estrogen, these cells will proliferate, shed, and bleed, and that blood will accumulate, inflammation will ensue, pain will occur, and the same cycle happens every single month. Let's talk about how it looks like for the most part, keeping in mind that signs and symptoms will vary from person to person, and severity will also vary from person to person. Some people are completely asymptomatic, and others not only experience symptoms during their menstrual cycle, they also experience symptoms all throughout the month. So this really varies. Endometriosis and adenomyosis share a lot of the symptoms, so I'm just going to mention them unless I mention that one symptom is specific for one of the conditions. You can assume that I'm talking about symptoms that you'd see in both. So painful periods is a big one, and I'm not talking about painful periods like, oh my god, I have cramps, I need 4 ibuprofen. No. I'm talking about need to go to the emergency room right now type of pain.
Give me all the morphine inside of my veins type of pain.
It is unbearable. For some women, it is so crippling. Another big one is heavy bleeding, and you see this in both, to the point where some people even develop anemia from all the blood loss during the period. We also see painful intercourse, painful bowel movements, chronic back pain, leg pain, infertility, bloating. Insert a picture of my endobelly right here. Endometriosis tends to have a little bit of a pattern. So typically, women will experience pain before their period, during their period, and then there's a moment of relief after the period is over. Again, this doesn't happen in every woman. It's just how it typically goes. A sign or symptom that is a little bit more characteristic for adenomyosis is an enlarged and tender uterus. Women also experience worsening uterine cramps and a sensation of fullness and pressure in the bladder/pelvic region. Okay, so those tend to be the most common ways women present. Let's move on to how these are diagnosed and treated. I think it's worth mentioning that both of these conditions have the potential for being misdiagnosed. So I highly encourage anybody who has pelvic pain of any kind or having any sort of symptoms that might look like this to keep a diary, a log of your symptoms. Write it down on a piece of paper, write it down on your phone. Just make sure that you have that information at hand. Pay attention to when the pain starts, when it goes away, where the pain is located, how does it feel, like how can you describe it, what makes it better, what makes it worse, are there any other associated symptoms. Make sure you have all that information at hand and provide that to your doctor, because that will help guide your physician into, at least doing the necessary tests so that you're able to be diagnosed. So what tests do doctors typically do to kind of figure out what you have? Obviously, a pelvic examination. Now, a pelvic examination is not going to, show any endometriosis, of course, or adenomyosis, but it can show some signs. Like I said, adenomyosis in particular, usually some women experience enlarged tender uterus. So a pelvic examination might show an enlarged and tender uterus and prompt your doctor to be like, okay, let's do some imaging tests. Ultrasounds are also done. Now, again, an ultrasound is not going to confirm that you have endometriosis, but it might show signs of endometriosis, such as cysts that are associated with endometriosis. And for adenomyosis, it might show a lesion in the wall of your uterus that might prompt your doctor to do further imaging tests, such as an MRI, which is another test that is typically done to see, what's happening in there. Now, an MRI will show endometriosis lesions and it will show where they are. MRIs can also show adenomyosis, but again, further tests are needed to confirm the adenomyosis, because sometimes they can be misdiagnosed as uterine fibroids, and that can be problematic. Another more invasive procedure that aids in the diagnosis of these is a laparoscopy. A laparoscopy is a small surgery where your physician goes through your belly button into your pelvic region, and with a little camera, they kind of go around the area and physically observe it. This procedure, although invasive, will be the most accurate because you're actually seeing the endometriosis lesions. So in summary, pelvic examination, MRIs, ultrasounds, diagnostic or exploratory laparoscopies are the exams that are typically done to diagnose either of these conditions.
I had to change spots really quick because there were chickens and roosters in the background, and it was driving me insane, and I was about to lose it.
Okay, so let's move on to treatment. In summary, treatment is either deal with it, give up your uterus, or become pseudomenopausal for 6 months. I'm kidding.
But am I?
Okay, in all seriousness, once your physician suspects or has confirmed that you have either of these conditions, one of the treatment options is hormonal treatment. So oral contraceptives, IUDs, progestins. The goal of this particular therapy is to minimize the bleeding that is happening every single month, because like we mentioned earlier, one of the biggest symptoms is heavy menstrual periods. So to minimize the bleeding and to minimize the pain, these tend to be prescribed. Another treatment option is GnRH agonists, which are drugs like Lupron. GnRH, or gonadotropin releasing hormone, to put it as simply as I can, it's basically a hormone that allows for the release of hormones such as estrogen in your ovaries. So what these particular drugs do is that they block that. They block the estrogen production. And like I mentioned earlier, these endometrial cells, they respond to estrogen. That is one of the hormones that allows them to proliferate, shed, and bleed every single month. So if you take that away, that's not happening anymore, which is why it is used. It is my belief, or at least my doctor told me, that this drug is used in is supposed to be used in 6-month intervals. I'm currently on it, so if anybody is interested in knowing what my experience with Lupron has been like, I would be very happy to make a video about it. But yeah, that is also one of the treatments. Now, the problem with that is that because you're blocking your estrogen, you're basically inducing a pseudo-menopausal state.
Hot flashes and all.
That's fun. Another form of treatment, and a more invasive one, is again a laparoscopy, which is again a small surgery where they go through your belly button into your pelvic region and they just physically remove the endometriosis. We don't do that for adenomyosis. The only cure for adenomyosis is to just remove the uterus altogether. In summary, for treatment, we have obviously pain management, hormonal treatment, our fabulous GnRH agonists, or surgery. But again, all of these end up being a band-aid, because for endometriosis at least, even a surgery does not really ensure that there won't be any recurrence later on. And often recurrence happens. Some women are symptom-free for a couple of years and then all of a sudden they have endometriosis again and they have to keep having surgery. For adenomyosis, you can't just go in and remove the adenomyosis because this is a lesion that's inside of the muscular layer. So the only real cure is to just remove the uterus or deal with it until you go naturally into menopause, which is messed up. There's no real cure for these conditions. You know, it's a very tricky situation, and it's different for everyone. My story starts in spring 2018. I do have to say that I was very fortunate to be diagnosed within a year and a half of developing symptoms, which is not the reality for a lot of women. A lot of women on average deal with these conditions for 6 to 8 years before they even get a proper diagnosis, which is messed up. Prior to that, my period was completely normal, or what I think was normal. I didn't have particularly heavy bleeding, and I didn't have particularly painful periods at all. I mean, I would have cramps, but I would just take some over-the-counter pain pills and it would subside. Obviously, some cycles were more painful than others, and some cycles would be heavier than others, but I thought that everything was dandy. I was very regular, I had no problems whatsoever, up until spring 2018. When I woke up on a random Friday morning and I was in severe pain, like severe pain. I took some pain medication, it didn't do anything, and I was in pain for over 12 hours that day. Not exaggerating at all. The pain started in my right pelvis and it would like spread out to like the lower right abdominal region. It traveled to my lower back, down my leg. I was very bloated. I couldn't walk because it was so painful, and it was very localized on my right side. Now, the pain was consistent. It never went away throughout those 12 plus hours. It didn't go away, but it did increase and decrease in intensity. So it kind of came in waves, the intensity. So it would peak in intensity and then it would kind of subside peak in intensity and subside, and peak in intensity and subside, and that was kind of its pattern. I had never experienced anything like that before. At that point, I was so sure that my appendix was about to burst because it was on the right side of all places, and I had never experienced that before. It happened all of a sudden. So it eventually ended up calming down and going away. I was a little bit sore, but it went away, so I felt a little bit more calm, and I ignored it. A couple of days passed, and I coincidentally had an appointment with my gynecologist. So I mentioned this to my gynecologist, and he's like, it may have been constipation or some other thing. It was the first time that happened. It doesn't really seem like it was a very serious situation. So we left it at that. I took it, left it at that. So after that initial time, it kept happening. It felt the same way every single time. Initially, the pain didn't have a pattern. It came sporadically during, before, after my period. And the way that it would be is that I would, again, wake up and be in pain for 8, 12 plus hours one day, and then it would go away. The next day I'd be fine. A couple of days, sometimes weeks would pass, then the pain would come again, and the same thing would happen. Again, it's important to note that initially there was no clear pattern to my pain. Fast forward to December 2018, I had been struggling with this pain for about 9 months at this point, and on and off. And I remember waking up one day in December, and I was in pain, and I was like, okay, I need to figure out what this is. So I went to the emergency room because I couldn't handle it anymore. And, pills didn't really work to subside the pain at all. So I went to the emergency room. They did a CT, they did an ultrasound, and the doctor comes back to me and he tells me, it looks like you have a fibroid in your uterus. I don't think that's the source of the pain because the fibroid is very small, but just know that. Everything else looks normal. And I was like, damn, like what the hell is going on with me? January 2018 comes along and nothing happened. I had no pain. I was living my life. My period came, my period went. It was a dandy time. February 2019 comes, and again, initially everything is fine. My period comes. But then, February 2019 was when all hell broke loose. My body decided to completely betray me. And right after my period ends, I start having this damn pain again. But this time, it kept coming back every single day. So right the same day that my period ended, I started having pain. Then it went away. Then the next day, I would wake up, feel fine. All of a sudden, it would start again. Hours worth of pain. And to sum it up, I was experiencing this for 7 days straight, which had not happened up until that point. Because that was a strange pattern, I got very worried. And I ended up going to the emergency room. I was in so much pain. I was given so many doses of like heavy duty narcotics, and I was still screaming in pain, so bloated, so in pain, like I couldn't even be touched, in my abdomen because it was so painful. During that hospital visit, they ended up telling me that it looked like I had a ruptured ovarian cyst. And they also told me that if the pain didn't go away in the next 48 hours, that I needed to go back to the emergency room. So surprise, surprise, the pain did not go away in the next 48 hours. So I had to revisit the emergency room, and this time it was a different hospital. So I had more tests done. I had another ultrasound. I had more pelvic examinations. They tested me for STIs, everything they did. And this time they ended up telling me, well, that fibroid that you have in your uterus looks a little weird, and it looks like it might be degenerating. I was like, okay, well, that's an answer. So I took it. The doctor that saw me told me that we needed to prevent the pain. So she advised me to take maximum dose of ibuprofen and maximum dose of acetaminophen every single day for weeks. So my liver was screaming, as you can probably imagine. Not to spoil the surprise, but obviously this didn't help, and the next month After my period ended, once again, I started having pain, but this time it was for 2 weeks straight. To make a very long story shorter, I ended up visiting the emergency room multiple times in a span of 4 months. And again, it was the same explanation. Everybody kept telling me the same thing.
It's a degenerating fibroid.
Nobody did an MRI or anything. I ended up getting prescribed oral contraceptives, which didn't really do anything because the pain kept happening. But what's interesting is that months prior, it didn't have a pattern, but since February 2019, it developed a pattern. It would come right after my period, like clockwork. As soon as my period would end, it would start, and it would last for days. At this point, it's affecting my life. I can't walk when I'm in pain. I'm in pain for hours on end. Nothing takes care of it. The pain feels more intense every single time. It's just bad. Summer of 2019 comes along, and at this point, I come back home to Puerto Rico, which is where I'm from. All of these hospital visits from February to May 2019, all of those hospital visits happened in Maine, which is where I was at the time. The same thing kept happening, kept having to go to the emergency room every month because the pain was unbearable. After a couple of visits to my gynecologist, who initially did not think that I had endometriosis just based on my history alone, finally, after some tests and some visits, he decided that a laparoscopy was indicated. So we scheduled that, and I purposefully made sure that the day of the surgery lined up with the end of my period. Because in my head, I was like, well, now I'm getting the pain every single time my period ends, like clockwork, like the very same day it's over, I start having this pain. So maybe something is happening that he can see, whatever. That was just my thought process. The surgery was scheduled for a Thursday. We did the surgery, and as soon as I woke up, the first words that I heard were, "Stephanie, you have endometriosis." We took it out. No. At that point, I cannot explain the relief that I felt. The Friday after the surgery, I wasn't even taking the pain medication that was prescribed. I was so fine. I was so happy. Obviously, it was sore and uncomfortable, but I was happy that I knew what it was. I had answers. We dealt with the problem. It was magical. Saturday after the surgery comes along, and I start having the same damn pain. And this time it was 1,000 times worse because the area had just been messed with. So it was the worst pain I had ever felt, like ever. If it was unbearable before, it was 1,000,000 times worse now.
It is day 4. Post-op, I thought that this would fix it, that I would feel better. But I don't. I felt so good on Friday. I thought that we had dealt with the problem and that everything was going to be okay. But it's not. It came back on Saturday, and then today, the same pain. Exactly the same pain. I just feel so exhausted.
So I ended up going back to the emergency room. I ended up getting admitted. I was in a lot of pain, and nothing was taking care of it. There was no relief whatsoever. And I have so many doctors on my bed. I have my internist, I have a surgeon, I have my gynecologist, I have now a gastroenterologist, I have an MSK doctor. I have so many people trying to figure out. I was tested for everything. They were testing me for a bunch of rare diseases. No one knew what was wrong. No one knew why I was in so much pain. But they were very kind. I was treated very well. They listened to me. I'm so grateful for them. After doing everything and finding that everything was fine and normal, everyone kind of said, okay, let's look at that fibroid more closely, because it's so strange. Everything is fine, and the only thing that's out of place is that fibroid. So we ended up doing an MRI of the fibroid with contrast, and wouldn't you know, my gynecologist comes back with a very apologetic looking face, and he looks at me and he says,
"Stephanie, it appears as if you have a case of atypical endometriosis / adenomyosis. what you have in the uterus is not a fibroid. It's adenomyosis.
And they found even more endometriosis that he hadn't been able to see when he was doing the laparoscopy inside of my ovary. So I was not shocked, but I was relieved. So now I was like, okay, well, are we gonna take it out or what's gonna happen? He's like, no, we're not gonna take it out, because the only way for me to treat your adenomyosis is to remove your uterus, and you're 27 years old. I'm not taking your uterus away. So the only option that we have right now is to do a GnRH agonist, aka the fabulous Lupron. And when he told me that, I was scared, because I googled and I went against my own advice, which is don't read forums. If you want to Google anything medical, go to research papers or reputable sources. Don't look at forums. It will make you crazy, and there's a lot of misinformation in there. Anyway, I had a moment of freaking out, but I was just happy I finally had the answers that I needed, and I went on the Lupron, and I have been pain-free for 5 months, which I'm so grateful for, because the level of pain that I was having was crippling. It was so emotionally exhausting too, because no one could really understand me. You know, I look fine, I'm fine, and I'm usually kind of like energetic and like all over the place, happy. And so I would be normal, and then all of a sudden I would have this pain, me not knowing what it was, and me thinking it was endometriosis, and then speaking to my doctors and them telling them, no, it can't be that, because it doesn't look like it. Like, it was just a very isolating, very hard and emotionally draining process. So far, I feel good. We'll see what happens in the future. Please feel free to share your personal story, struggles, conundrum, or deal with endometriosis or adenomyosis. Subscribe, like the video if you enjoyed it or if you learned something. And yeah, let's talk about this. Let's have a conversation in the comments, because I think it's important for us to, you know, raise awareness about this issue. It affects so many of us. If you want me to make a video about my personal experience with Lupron, you know, the side effects, symptoms, all of that, leave it in the comments down below. I will be so happy to make a video about it. To be honest, my experience hasn't been completely negative, and there's a lot of negativity online about Lupron. That's it for this video. Thank you so much for watching, and I'll see you next time.